Assalamualaikum warahmatullahi wabarakatuh. Hi, good morning everyone. Welcome to my YouTube channel. First, let me introduce myself. My name is Nisa and you can call me Dea, and I'm a nursing student from Health Polythecnic of Semarang. Today, I'll go on to talk about what is depression. So, let's move on to our discussion. Okay, so first, what is depression? Depression is the leading cause of disability in the world. In the United States, close to 10% of adults struggle with depression. But because it's a mental illness, it can be a lot harder to understand than, say, high cholesterol. One major source of confusion is the difference between having depression and just feeling depressed. Almost everyone feels down from time to time. Getting a bad grade, losing a job, having an argument, even a rainy day can bring a feeling of sadness. Sometimes there is no trigger at all. It just pops up out of the blue. Then circumstances change and the sad feeling disappears. It's a medical disorder and it won't go away just because you want it to. It lingers for at least 2 consecutive weeks and significantly interferes with one's ability to work, play, or love. Depression can have a lot of different symptoms, such as low mood, loss of interest in things you normally enjoy, changes in appetite, feeling worthless or excessively guilty, sleeping either too much or too little, poor concentration, restlessness or slowness, loss of energy, or recurrent thought of suicide. If you have at least 5 of the symptoms, according to the psychiatric guidelines, you qualify for a diagnosis of depression. Neuroscientists still don't have a complete picture of what causes depression. It seems to have to do with a complex interaction between genes and environment. But we don't have a diagnosis tool that can accurately predict where or when it will show up. And because the present symptoms are intangible, it's hard to know who might look fine but is actually struggling. According to the National Institute of Mental Health, it takes the average person suffering with a mental illness over 10 years to ask for help, but they are very effective treatments. Medication and therapy complement each other to boost brain chemicals. In extreme cases, electroconvulsive therapy, which is like a controlled seizure in the patient brain, is also very helpful. Other promising treatments like transcranial magnetic stimulation are being investigated too. So if you know someone struggling with depression, encourage them gently to seek out some of these options. You might even offer to help with specific tasks like looking up therapies in the area or making a list of questions to ask a doctor. To someone with depression, these first steps can seem insurmountable if they feel guilty or ashamed. Point out that depression is a medical condition just like asthma or diabetes. It's not a weakness or a personality trait, and they shouldn't expect themselves to just get over it any more than they could will themselves to get over a broken arm. If you haven't experienced depression yourself, avoid comparing it to times you felt down. Comparing what they are experiencing to normal, temporary feelings of sadness can make them feel guilty for struggling. Even just talking about depression openly can help. For example, research shows that asking someone about suicidal thoughts actually reduces their suicide risk. Open conversation about mental illness help erode stigma and make it easier for people to ask for help. And the more patients seek treatment, the more scientists will learn about depression, and the better treatments will get. Okay, that's all I want to say for now on. And I like to end with a summary of the main points to all of you guys. Get enough sleep, eat well, exercise regularly, reach out family and friends when time get hard, get a regular medical checkup and see your provider if you don't feel right, and get help if you think you're depressed. Okay, that concludes my talk for today. I'd like to say thank you for taking time out to listen to my presentation. I hope you guys enjoy it. Stay safe and stay healthy. Goodbye and see you later. Wassalamualaikum warahmatullahi wabarakatuh.